Oh, we're live in 5, in 4, in 3, in 2, in 1. We are live Tuesday nights. Staiano here, plastic surgeon to the stars. You got the Q's, I got the A's. We're talking Q's and A's, mainly plastic surgery related. Well, only plastic surgery related. Actually, I'm not out. I'm staying in my lane. I'm not trying to profess any knowledge about any other aspect of life or the world. Hi, Jackie, long time no see, or maybe it's just been a week. So yeah, but you know, a week is a long time in showbiz, and yeah. So if you've got any cues, then cue them up, and they can get in the queue, and they will be aid by yours truly. So if you haven't, that's fine. You know, that's absolutely fine. Don't feel bad about it. I mean, no need to make a big deal of it, because I've got some, and I'm going to start with this one. So if you're going to ask this, then don't worry, because someone else has already asked it. Do we offer treatments for hyperpigmentation? No, we don't. So hyperpigmentation is increased pigmentation, so dark areas, dark spots, dark patches, and that would be more of a dermatologist. So one of the, what was it? I did something. Was it a blog? No, it was like a thing on Canva, wasn't it? Dermatologists and plastic surgeons. That's right. I did a thing on Canva, which I think I posted on something on Instagram or something, or TikTok maybe. If I haven't, I should have done. Anyway, differences of plastic surgeons and dermatologists. In plastic surgery, there's often areas which are overlapped, where different doctors will treat the same thing. Rhinoplasty, for instance, nose jobs, prominent ear correction. You'll often get rhinoplasties and ear corrections being done by ENT surgeons, ear, nose, and throat surgeons, as well as plastic surgeons. So yeah, there's a bit of overlap in terms of dermatology treatments and things. So there are some things that we both treat, but there are also some things that just one of us treats. And hyperpigmentation is one of those things that I personally wouldn't treat. It requires medical treatments, creams, ointments, bleaching agents, and things, and whatnot, as they say, whatnot, and they're not to be taken lightly, and probably needs someone to look after you for it, and that someone would be a dermatologist, not myself. I don't know, maybe some plastic surgeons, in fact, I bet some plastic surgeons do this sort of stuff, so I shouldn't tar everyone with my brush. I'll keep my brush to myself and just say that I don't do it, but there probably are plastic surgeons out there who would treat hyperpigmentation, but you're not looking at one of them. I'll be honest with you, I just do surgery stuff, you know, and I understand how a lot of, especially plastic surgeons with their own clinic, have got into non-surgical stuff. And, you know, yeah, you're probably right. I probably should do it. I probably should do non-surgical stuff. You know, Botox, fillers, lasers, all these machines that, you know, radio frequency and goodness knows what. But I can't get behind it really, and that's just me. And at the end of the day, I'm just as God made me. So what can you do? So yeah, I'm mainly surgery. What we do at the clinic, we don't do non-surgery things. And hyperpigmentation would be a surgical thing, unless it's kind of like a little area which we could excise. But excision would probably be a bit of an extreme treatment for hyperpigmentation, and I would probably recommend looking at some non-surgical treatments first, because obviously if they work, then that's worked, and that's better. I was quite hard to see this too. Saying hi. I can't really read because it's sort of white on white. I think it's my shirt that's the problem, actually. My shirt I've got white writing with the background of my shirt, which is kind of white. So I can't read what's going on there. But anyway, I'm just going to carry on as if nothing's happened because that's how I've been taught, you know, the media training and all. Are there increased risks having a lipoma removed under general anaesthetic as opposed to local anaesthetic? Yeah. And that would be anaesthetic risks. So in terms of surgical risks, no, the risks would be the same. And the only reason for doing something under general anaesthetic instead of local anaesthetic would be, well, mainly because of the lesion. Maybe it's deep, maybe it's under muscle, maybe it's big, and it's too big for us to get enough local anaesthetic because we're limited as to how much local anaesthetic we can use, because you can use sort of like a toxic dose of local anaesthetic. So you can only use so much local anaesthetic. So it's extremely large, probably not that big, but you know, if it's extremely large, then or as I say, deep underneath the muscle. So if there's reasons we can't do it, then we would need a general anaesthetic. But the actual surgery is usually the same. You're doing the same thing. It's just you can't anaesthetize the area. The other reason, I guess, would be if the patient's very anxious and you know, it would have to be a pretty big lipoma anyway. But if they were more leaning towards a general anaesthetic, then that might be another reason for it. So so the surgical process is usually pretty similar, but it's just sort of getting the area numb in order to do it. But the risks, there's obviously anaesthetic risks. So there's anaesthetic risk of local anaesthetic, which is mainly in terms of the toxic dose of using too much. So there's risks in that respect of doing a very big one under local anaesthetic, but also there's risks of a general anaesthetic. So if it's not clinically warranted, we would usually prefer to do it under a local anaesthetic if we can, because the risks are less. You don't have sort of systemic agents in your body which can cause reactions, anaphylaxis. You don't have a tube down your mouth. You don't have that sort of hungover effect that you have after anaesthetic. I mean, if you did need a general anaesthetic, it would be a short general anaesthetic, so it wouldn't be like a big op. So, you know, I don't think the risks would be huge, but the risks are there. So it's better to avoid those anaesthetic risks if you can, and have a local if you can. But if, as I say, if you had to have a general, then you would have to take on the increased risks associated with any general anaesthetic. There are risks, mainly anaphylaxis, chest infections, because you've got a tube down your throat. You know, problems with teeth because they put something in your mouth, so you can damage teeth, sort of crowns and things. Probably need to speak to your anaesthetist about the risks of general anaesthetic, but you know, there are risks with general anaesthetic. But yeah, surgical risks will be similar because the surgery will be similar. By the way, don't all rush in with your questions at once, because I don't want to get inundated. So if you can just form an orderly queue and just one at a time, because obviously when you're an influencer like myself, you're going to have so many questions rushing at you. You've got to just you know, take them one at a time. So yeah, okay, I haven't got any as of yet. Okay, I'll carry on with mine. Have we? No. Okay, that's fine. Right. Okay, anyone? No, right, good. Okay, it doesn't matter, I've got one here. How long before I can return to the gym after having a lipoma removed from my abdomen? Depends on how big the lipoma is, you know, abdomen, because abdomen can be big ones, and also abdomen ones can be deep. So, you know, there are levels of lipoma removal. You get these little ones where you just sort of pop out and it's like literally takes a couple of minutes, and you get big ones that are all stuck and don't come out nicely at all. So it depends to some degree on that. Now, I must confess, I am not an expert with what goes on in the gym. I have frequented the establishment in my time, but it is not a place that I can be commonly found. So, in general terms, that skin is going to be healed in a week. You probably could have a waterproof dressing on for a week, and then dressing comes off. So you don't want to get hot and sweaty in that week. So taking it easy in that week. Once the dressing comes off, then you can start doing stuff, and you can do things like walking. Do you do walking at the gym? Is that a thing? Gym walker. You can do the walker at the gym, but you don't want to be doing a clean and thrust. Anything that puts pressure on your tummy, you don't want to be doing that, because that's going to be putting pressure on your scar. You don't want it opening up. You don't want it stretching. So that's a month. That's a month for your clean and press. A month before you clean and press, and kind of core stuff, you know, sit-ups and stuff like that. Now, the good thing about a lipoma is it's a subcutaneous lesion, so we don't actually take any skin out when we do a lipoma usually. So we just make an incision in the skin, unless it's very superficial and tend the skin up a lot. But usually it's just an incision in the skin, so it's not under a lot of tension. So that's a good thing. That means it's not so prone to sort of opening up or stretching. But still, you kind of want to take it easy, I would say, for a few weeks. Let me put it like that, a few weeks. And then just start getting back. If you feel it's pulling, then maybe ease off. But nothing too crazy for a few weeks. You can do lower body stuff, things that's not putting attention on you. Maybe sitting on the bench and doing the weights like that. You know, I've seen them do that. You're looking at yourself in the mirror, looking at your arms. You could be doing that maybe. So once the dressing comes off, that after a week, you could be doing that with your arms, and you could be walking, but nothing that's going to put tension on the wound on your abdomen, which means core stuff, clean and thrust, sit-ups. You know, I suppose running, you know, boom, 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 boom. You don't want to be doing too much running, but walking's good. Why don't you just do walking? In fact, why don't you just walk anyway and don't go to the gym? Save yourself some money. But anyway, if you do want to go to the gym, yeah, 3 or 4 weeks before you're be putting pressure on your abdomen, so core stuff and what have you, and clean and thrust after 4 weeks. Are you able to explain how you know that I have a cyst? Because there isn't a lump under my skin. It just feels flat and feels normal. Right. I know the context of this. You don't. So you're probably thinking that's a weird question, but I do know the context. And the context of this is a patient who had showed us a photo of a cyst, a red lump. And I said, oh, that looks all red. That looks like it's infected. Wouldn't be able to remove it while it's all red and infected, so we can't remove it. And so then a couple of weeks later, they sent another photo saying, oh, it's gone. It's basically gone. And I said, well, now's the time to remove it, because it obviously was a cyst, but it's just now gone quiet and has burst or whatever, and the infection's gone and it's settled down. So now they're saying, how do you know I've got a cyst? Well, the reason I know they've got a cyst is because they sent the photo a few weeks before with a big lump on their face, with a big red lump. So obviously, if you've got no lump and you can't feel anything, there's nothing there, there's no reason to believe you've got a cyst. But if one day it all balloons up and then that balloon goes, I mean, we'd have to examine you in clinic, because usually you can feel something in the clinic. I mean, if you genuinely can't feel anything and you can't quite remember where it was, I mean, obviously we've got a photo, you know, we might be in trouble if there's really nothing to feel, but you can usually feel something, even though the cyst is kind of deflated, because what we need to do is we need to remove that cyst wall, because if you don't remove that cyst wall, it just comes back again. And the time to do it is when it's quiet, not when it is red and angry and swollen. So so the reason I know there's a cyst there is because of the photo a couple of weeks later with a big lump on your face, which is all red. So as I said, we'd see you, and if there genuinely was completely nothing to feel, nothing to see, and it's all fine, then yeah, okay, fair enough, you could leave it. But just keep an eye out, and if it does start to sort of swell up, you know, you want to get it when it's small if possible, but also quiet. So you don't want to have skin red, inflamed, because we won't remove it then. We have to wait for it to be quiet. Like the live, keep it up. Good. Got a like. Oh, Kelsey. Hi, Kelsey. Long time no see, Kelsey. Hope you're well. Good to see you here tonight. You're over the angle, so I can't see because I've got a bent up phone and I've bent it up to make it do that. But I'm keeping up. I'm getting lots of likes on the live on TikTok, but oh, it's all the same person. Anyway, that's fine. That's fine. You know, doesn't matter. Good. Thank you. Thank you for liking. I can't see the name because my shirt there. If I do that, I can see it. Heath? Yeah, thank you. Oh God, well, oh, done that one. Cyst, yeah. Right, what we got here? Well, this is probably the same patient. Can we remove an abscess? So this is probably the same patient a few weeks before. Can we? Would we? We tend not to get involved in abscesses. Is the answer to that? So I guess any surgeon, I guess, could have a go at an abscess. An abscess usually just needs draining, so kind of lancing, putting a knife in, and letting the evil humours out. Sometimes there's a cavity, and you'd pack the cavity and things like that, depending on where the abscess was and how bad the abscess was. But it's usually a general surgeon. That'd be, if it's going to be a surgeon, I mean, often antibiotics and what have you. So in terms of removing an abscess, you don't actually remove an abscess. You kind of treat an abscess by letting the evil badness out. But you don't do kind of surgery. So let's say it's a cyst that's formed an abscess. You wouldn't do surgery to remove the cyst while it's an abscess for two reasons. First of all, the local anaesthetic doesn't work and it's a nightmare. Second reason, everything's inflamed. The cyst wall is like soft, wet paper. It's there's no good planes. The local doesn't work. You just don't do it. If you made a cut to get the cyst out, you stitched it up, that cut will get infected. So it's completely not. Now is not the time to remove the abscess. So you don't, or the cyst, you don't remove a cyst when it's in an abscess. So when it's an abscess, when you've got an infection, we wouldn't get involved. We'd normally say GP, who might refer you to A&E and general surgery or whatever, depending on how bad it is, who might lance it, might give you antibiotics or whatever. When the abscess settles, if there is a thing, i.e. a cyst or something, then yes, that's when we would step in and remove that cyst or that whatever it was that had got infected. But so we don't get involved in the abscess stage. We step in and take the glory once the abscess has settled. So yeah, so can we remove? So yeah, as I say, you don't really remove abscesses. You just treat abscesses. You drain the abscess. You don't do definitive treatment when something's infected. You do the minimum amount of surgery because you don't want to give extra scars and stuff because they'll get infected. So you normally just open it and leave it open. Kind of normal for abscess. Last question, everyone. So if you do want to get your questions in, just to say, clearly we've been inundated tonight with questions, but if anyone did want to ask a question, then they would be more than welcome. But do you recommend having a mole removed by a plasma set pen? Full disclosure, I don't know if it's good or bad of me to say this, but hey, among friends here. So I've had to Google plasma pen. I mean, I've heard the words, but I didn't know what it was. I've got to be honest, I still don't know what it is, but it's some kind of, I've lost the page now, but it's some kind of non-surgical energy delivering device. So no, I don't recommend having a mole removed by plasma pen. I'm not even sure if you could. Is it something that it was talking about other stuff? Is it something that they say that can remove moles? I'm not even sure if it could remove a mole, but I wouldn't recommend having a mole removed by a plasma pen. So mole removal involves removing the piece of skin, and there are ways you can kind of deliver energy to the skin to I guess remove that piece of skin. I'm not sure if plasma how it delivers the energy, whether it's sort of focused and like a cutting thing, or if it's just sort of like a laser thing or what. But either way, you're going to have to remove the thickness of the skin. So whether it's a burning like a laser, or some lasers do sort of cut it out. They both. So the reason I think usually people are asking this is because they think it's less scarring. People often think, oh, I want to have this way of mole removal. What about a plasma pen? Because that's not like surgery. That's kind of like a topical thing. Or what about using this acid or this vinegar or this whatever laser, or because that's not going to give me a scar. And if you're going to deliver enough energy to remove the mole, you're going to destroy that thickness of the skin and you're going to leave a mark of some kind. And there's different ways to destroy that skin, and a scalpel is one way, a laser is one way, acid is one way, a spoon to scrape it off is one way. So they all destroy that piece of skin. Personally, I don't recommend laser. I don't recommend plasma pen because they sort of burn it, and they, well, I say they, I don't know what plasma pen does, but laser sort of, it might be like laser, burns it, and you can't send it for histology. Now you might say, well, I know it's benign, it doesn't need to be sent for histology, in which case fine, you could do it, but you can't, it's a bit more difficult to control the level of damage to the skin with these things. So I'm saying hi to Ayat, but it's not letting me say hi. Is that saying hi? Saying hi. So it's a bit more difficult to control the energy of a thing like laser. I mean, as I say, I don't do it, so you probably have to speak to someone who does it to get a balanced opinion. And so the concern is if you deliver too much energy, you will create extra scarring, and if you don't deliver enough energy, then you will not remove the mole. So you kind of have a mark, and then the mark heals and the mole's still there. So it's, again, probably best speaking to someone who does these sorts of treatments to see what they say about it, but it is not something I recommend because it's more difficult to predict the level of scarring, I find personally. And as I say, I only do excision, so you can do a shave or a formal excision or whatever, but I use a knife to actually remove that piece of skin with the mole in it, and I find that is more predictable in terms of the level of scarring that you're going to give, and you can be a bit more kind of realistic to the patient about what they can achieve. Well, I shouldn't say more realistic, because maybe all these people are realistic as well. So anyway, give patients an idea of what they can achieve. And B, what was B? Oh yeah, histology. Send it for histology. So I think it is, a lot of people say that you don't leave scars, and I want to have laser because laser doesn't leave scars. But or I want to have plasma pen, or I want to have acid or whatever, but your mole might be quite superficial, so it hasn't damaged that much of the skin, so the scarring isn't that bad, or it might be like when we do excision, so you plan it and it heals so well that it's hard to see the scars. Usually there's some kind of mark of where that was removed, but it often heals so well that you can't see it. So yeah, that's so yeah, I do not recommend the plasma pen. Oh, what's that? Someone invited me to co-host there. Don't tell me someone wants to do a dual screen. Anyone want to do a dual screen? Do that on Instagram and TikTok. Well, I don't know if you can do it on TikTok. I know you can do it on Instagram. I've got to be honest, never done it before. People have often said invites you to join the thing, and then I always say, do you want to join the thing? And they always say I accidentally pressed the button. So I don't think anyone genuinely wants to do a dual screen invitation. But if they do, I'm up for it. What's the worst can happen? Anyway, I think that was probably a misclick. I missed who it was there. So I'm going to declare myself out at this point, but you know what? Tomorrow's another day, and next Tuesday is another week, in fact. So I will be back on next Tuesday with another one of these insightful, educational plastic surgery Q's and A's. So if you've got any A's, then please do hit me up, and I will do my level best to Q them. No, if you've got any Q's, I will A them. Yeah. If you've got any Q's, then let me know. And if you're lucky, no guarantees, they might get on the list for next week, and I will go through them then. So I wish you a good night, and without further ado, I will stop.